Dr. Ruffin, and I am coming to you today to assure you that your pediatricians in town are willing and ready to serve you. Our offices are remaining open to accommodate the increased numbers of sick patients. Specifically at Heritage Pediatrics, we have accommodated our hours and we are available anytime you need us. As of today, 25% of all COVID cases are accounted for in the pediatric population. That is a significant increase in what we saw last year. For those of you who are eligible for the vaccine, I encourage you to strongly consider getting vaccinated against COVID. Lastly, please remember that your pediatricians have partnered with the local school system and Russell Medical Center to stay abreast of the numbers and to do what is best for our community.
Hi, I'm Dr. Sellers. Would like to speak to the parents of my patients and talk about COVID-19. As I'm sure most people know, COVID-19 is a new virus. We have very little experience with it, not the hundreds of years of experience like we have with flu, but we do have about a year and a half of experience. So we've learned some things about it, and lots need to be learned in the future. I wanted to talk with you a little bit about if you think your child may have COVID, or if your child has symptoms that make you worry about COVID, or if your child does in fact have COVID, what do we need to do? First thing I'd like to say is that if you have a child that has symptoms that you think might be COVID symptoms, I don't think it's a good idea to go to the emergency room at the hospital to have evaluation done unless you're in a crisis situation, unless you're in a situation where the child is having difficulty breathing or has lost consciousness or some other major symptom. The first thing you need to do is call your pediatrician. Find out from your pediatrician's office what the recommendations are. And it oftentimes is going to be simple, basic symptomatic treatment and get a COVID test. Some of the offices I know are doing COVID tests themselves. Some of the offices are referring their patients to Mill 280 for COVID tests or to other facilities for COVID tests. Once you find out if the COVID test is negative, then you treat the set of symptoms like you would any other cold or GI symptoms due to other viruses. In the case of COVID, those are the symptoms that we're going to see most likely. It's going to be respiratory symptoms with cough, congestion, runny nose, sometimes sore throat, headache, or some GI symptoms, which would be vomiting, diarrhea, or abdominal pain. Fever is not consistent, but fever is often seen in cases of COVID. So if you see these things and you have a negative COVID test, then the chances are it's not COVID, and your physician will probably want you to come in and be examined and be treated. If you have a positive COVID test, then the treatment oftentimes is by televisit, by telephone, or if it's severe enough, you might be referred to a treatment facility where you could get specialized treatment. In our case, we usually refer our very sick patients to Children's Hospital. Children's Hospital is a full-service hospital, and they have all the specialists and the equipment needed to take care of this. If you're in a situation where you've had very close COVID contact with someone, either other family members or at school or at church, and even with the COVID test within a day or two of that contact, even if the COVID test is negative at that time, a second or even third COVID test might be needed. Oftentimes, the COVID test does not turn positive for somewhere between 3 and 5 days after contact. So don't be lulled into complacency if you get a negative COVID test within the first day or two of contact. One of the things that I get asked a good bit is, how do I know that my child hasn't already had COVID in the consideration of whether they need vaccination or not? And one of the things that we use to determine that is to order a COVID antibody test. And if your child has COVID antibodies, then they've had COVID. If the child does not have COVID antibodies, then the likelihood is that they have not yet had COVID. It doesn't mean that they definitely haven't had COVID, but there is a likelihood that they have not had it yet. So I think that's an important dividing point. And if the child has had his antibodies and has had COVID, then they probably don't need a COVID vaccination at that point. But if the child has no COVID antibodies, then I think serious consideration about COVID vaccination should be given.
Hi, I'm Dr. Arnold Tauro, pediatrician working with Dr. Tyler at Pediatric Associates of Alexander City. The national and local data released recently has shown that rapid increase in number of pediatric COVID patients for the past 6 weeks. The number of pediatric patients with COVID peaked in the month of December 2020 and again in the month of August 2021. Last year, we had alpha strain of COVID virus. A person with COVID alpha variant with 8 to 9 minutes of close contact could infect 2.3 people around him. This year, mostly we have Delta variant, which is more contagious. A person with Delta variant unmasked with 60 seconds of exposure or close contact could infect 9.5 people around him. In the month of August 2021, we tested about 400 patients with 20% positivity rate. 2 large studies done recently in large school systems in California and North Carolina have proved that masking, hand sanitizing, and 3 foot distancing makes the risk of transmission of infection no greater than being in the community. That means increased number of pediatric COVID patients, not only because of opening of school, but also increased number of adult patients in the community. We have COVID vaccine for ages 12 and up, and the vaccine for younger age group may be available next year. The Pediatric Associates of Alexander City is sponsoring next COVID clinic on Saturday, the 25th of September. If a child is age 12 and up, please reach out to us at 256-234-5021 to schedule an appointment for COVID vaccine so that they can remain safe in the school. If a child has any symptoms or have been exposed to COVID, please call our office to make an appointment. We have 2 offices in Alexander City and Kellyton. We have dedicated, hardworking, friendly staff to take care of fewer children as family. We want to keep the children of this community safe and healthy. The pediatricians of this community are in constant touch with the school system and Russell Medical. If you have any questions about COVID, you can always go to the Facebook of Pediatric Associates of Alexander City, where you can find out about COVID, the trends, wonderful videos from Dr. Tyler about vaccination, recommendation, We have a great community with great leaders, especially the school system and Russell Medical. Let all work together and accomplish great things. Thank you.